Hello. I decided to make a side effect video, side effects that you might encounter as you're going through your chemo treatments and dealing with the other medications that are supplement to those chemotherapy medications. So again, it's Jamie. I have triple negative breast cancer, stage 2B. I am on ACT as my treatment plan. That's the chemo medications, adriamycin and Cytoxan currently. I'm doing 4 cycles of the adriamycin and Cytoxan, and tomorrow I will be going for my 3rd. So I'm more than halfway, or I'm halfway through, and tomorrow will make it 3/4 of the way on my first round of chemo. So the biggest side effects for me that I have, of course, is the hair loss. I did lose my hair 14 days after my first session. It started falling out. So I ended up, prior to it falling out, like a week before, I cut it very short. And then on day 14, I took a shower, washed my hair, and noticed lots of hair coming out as I was washing it. And then when I got out the shower, I combed through it. A bunch more hair came out. I have very, very thick hair, so it still looked very normal, even though I had like 3 handfuls of hair. So yes, the hair loss. And so far, I've lost it on my head. And this might be TMI, but pubic hair gone. Underarm hair is pretty much gone as well. So I didn't realize that would happen. And I did notice today my left brow is looking kind of shady, thinning out. So those are probably to be going soon. My next biggest side effect that I experience is just the fatigue. Totally tired. I go to chemo every 2 weeks. And so the day of chemo, I'm great. No problems. I go to chemo, and if I'm done early enough, sometimes it's an all-day situation, I can go out and hang out with my friends, run errands, and feel fine. On day 2, 3, 4, and sometimes 5 is when the fatigue sets in. I just feel just icky. I don't have nausea, but I feel just sick, like I'm coming down with the flu. Sometimes there's chills, sometimes a slight fever. Just feel bad, like you don't want to get out of bed. And I sleep those first few days. I take 2 or 3 naps a day. No getting around that. I do try to work out, like go for a mile walk on those days, just so I can get my exercise in, because exercise is also a part of my treatment plan. Other side effects that I have: dry skin. I have oily skin, like my face is very oily. I've noticed it drying out tremendously, which is great because I have less blemishes. But on the downside, the rest of my body, very dry, especially my hands. I also one of my nails is turning black. If you can see toward the cuticle, and I can literally see it changing by the hour right now. But it's only that one thus far. The palms of my hands, I have these spots. You see those dark and white spots? And my hands are starting to darken on the palms as well. My head aches. The hair follicles, I'm assuming there may be, because they're dying off or inflamed, it causes pain and sensitivity. So sometimes I can't even put anything on my head because it hurts so much. I do take Tylenol to help combat that, but mostly just being careful, trying not to touch it. I have watery eyes. And this one usually drains constantly. It's actually been pretty good today. I also have a constant runny nose. Another side effect you may experience because chemotherapy attacks fast replicating cells. Your mucous membrane, so inside your nose, your mouth, your esophagus, those things become very sensitive. Stay away from spicy foods. Don't try it. I tried mild salsa one day. It felt like I had threw ghost peppers down my throat, and it was miserable. Heartburn. That's another side effect that I experience, and I understand a lot of people who are on chemotherapy experience as well. Mouth sores. I haven't had any, thank the Lord. I hope it stays that way, but a lot of people at this stage start to experience mouth sores again because of those mucous membranes. I've been combating that based on the information my doctor gave me. When you eat, after you eat, make sure you brush your teeth gently and rinse your mouth. The saliva in your mouth does not act on the sugar, alcohols, or anything left in your mouth like it would if you weren't on chemo. And to protect your teeth enamel as well as your gums, just rinse your mouth. You can use regular mouthwash. Make sure you get the kind that doesn't have any alcohol in it, or you can do it at home, which I do as well, like sea salt and hot water, or baking soda and hot water, or warm water to rinse out your mouth after you eat. And it also helps if you have that metal taste in your mouth. I found that the sea salt and the baking soda salt before I eat helps my palate, helps the food taste almost normal. And so that's the other side effect. Food tastes differently. A lot of it tastes like metal. I've decided I only eat with plastic utensils now. It's like I don't need any extra metal taste in my mouth. So you might want to try that to help alleviate that situation. What other issues do I have? I think that's it as far as the side effects I have. Everyone is different. The medications interact with everyone differently, so people may experience different side effects. If you are experiencing them or something is changing and you're not sure why, just run it by your doctor and make sure you stay on top of things, just to be safe and proactive. A lot of the side effects have, there's remedies for them. Your doctor may not initially prescribe you, a medication. So unless they know what you're going through, they may not know to prescribe that particularly for you. So for me, the medications used to help with the side effects of chemo that I'm taking are anti-nausea medications, and my doctor has prescribed me 3. One of them I can take at night. It kind of helps. It makes you drowsy, so it helps me sleep, because another side effect is I'm not sleeping 8 hours anymore. I have very interrupted sleep. I also take Zantac. I take 75 milligrams twice a day to help with heartburn. Claritin, but I actually only take those the first 5 days after chemo, and as well as a steroid that I take only for 3 days after chemo. And then I have 24 hours after my chemo sessions, I have to give myself a shot of Neulasta, which is a booster for red and white blood cells. That particular medication does cause me a side effect of bone pain. So my legs actually ache, kind of what I would imagine like an arthritis might feel like, kind of a constant ache. So those are my side effects. Get with your doctor. Don't be shy about it. Voice what's going on so they can help you. If you have any advice and you're a patient going through this about any of the side effects that I have, please leave a message. And if you have any kind of hacks to just kind of help people get through those, that would be wonderful. So I hope this video sheds some light on some of the stuff that we as cancer patients are going through. If you are a friend or family of a patient, hopefully this can help you, kind of understand if they're not verbalizing everything that's going on and, how they may feel. We'll come to you again with another video regarding my journey. I'm actually going to try to do a video tomorrow at my chemo session so you can see what that looks like. Have a wonderful day. Please like my page and subscribe. I want to be able to share as much information and be transparent to my friends and family, and those of you who are going through the same situation or have family members who are, just want some, to know someone is going through it and might have some information that might be helpful to you. So have a wonderful day, and I will talk to you in the next video.